So Tom had been a patient of mine for over 8 years. He's a 33-year-old man with what's called schizoaffective disorder, which is a cross between schizophrenia and bipolar disorder. And he was tormented by his mental symptoms. He had hallucinations every day. He had paranoid delusions. He was terrified to go out in public, convinced people were trying to hurt him or they were talking about him. He was convinced people had these technologies that they could beam his thoughts to other people or they could put thoughts in his head. Tom had tried over 17 different medications. None of them stopped his hallucinations and delusions, but they did cause him to gain a tremendous amount of weight. And at some point, he asked for my help to lose weight, and we decided to try the ketogenic diet. Within 2 weeks, not only did Tom start losing weight, but I started to notice a really powerful antidepressant effect in him. He was actually making better eye contact, smiling more, talking a lot more in a way that I had never seen. But he was still having hallucinations and delusions. It was about 2 months into the treatment. So he was on the diet for 2 months, losing even more weight. And he started to spontaneously report to me that his long-standing hallucinations were going away. His paranoid delusions were also starting to go away. He actually started to recognize that they probably had never even been true. Like when he would hear himself saying it out loud, he's like, gosh, now that I say that, it sounds crazy. And maybe I've had schizophrenia all along. For the longest time, he didn't believe he had schizophrenia. He thought these things were really happening to him, that people really were tormenting him or, targeting him. And it was impossible to convince him otherwise. He was just convinced this is reality. Why won't anyone believe me? Why won't they take me seriously? I'm not schizophrenic. I get that other people are schizophrenic, but I'm not. And why won't people take me seriously? And now he started to recognize, oh my God, maybe I've had schizophrenia all along because this doesn't sound even reasonable or rational. Tom went on to lose what's now 160 pounds and has kept it off to this day, 6 years later. But much, much more importantly, Tom was able to do things he hadn't been able to do since the time of his diagnosis. He was able to go out in public and not be paranoid, complete a certificate program. He was able to perform improv in front of a live audience, move out of his father's home for a time. And that completely upended everything that I knew as a psychiatrist. Because number one, diet is not supposed to help something like schizoaffective disorder. Number one. Number two, schizoaffective disorder is not supposed to go into remission. It's not supposed to get better. We tell people this is a lifelong disorder. You're going to have this forever, even with the best treatments we have to offer, even with the best pills we have. The majority of people will continue to have symptoms and be tormented by their symptoms. And that kind of set off a whole new phase of my career. The ketogenic diet can improve mitochondrial health and the number of mitochondria cells, and that can result in the brain functioning normally again, and that can help people heal and recover from chronic mental disorders.